Should parents consider puberty blockers for their trans child? When it comes to the question of whether parents should consider puberty blockers for their transgender child, it is essential to look at the facts. Puberty blockers are medications that can pause the physical changes that occur during puberty. They work by suppressing the body's production of sex hormones like testosterone and estrogen. This can be especially helpful for transgender or gender-diverse youth who may feel distress about the changes happening to their bodies. So, what factors should parents think about? First, it is important to consider the child's consistent experience of gender dysphoria. This is the distress that arises when a person's gender identity does not align with the sex they were assigned at birth. If a child has been expressing this feeling persistently, it may be a sign that they could benefit from puberty blockers. Another key factor is the timing of puberty. Puberty blockers are most effective when started in early to mid-puberty, before many physical changes take place. This allows the child to have more time to explore their gender identity without the pressure of irreversible changes. It is also crucial to have a comprehensive evaluation by healthcare professionals who specialize in transgender youth care. This should include mental health support to ensure that the child is receiving well-rounded care. Now, let's talk about the benefits. One of the main advantages of puberty blockers is that they can pause unwanted physical changes. This can significantly reduce distress and improve mental health outcomes, such as lowering anxiety and depression. Additionally, they give families more time to make informed decisions about future steps in gender-affirming care. This can potentially lessen the need for more invasive medical interventions later on. However, there are some risks to consider. Possible side effects may include reduced bone density and changes in fertility, especially if the blockers are started later in puberty. The long-term effects on brain development and fertility are still being studied, but current evidence suggests that short-term use is generally safe. It is also important to note that puberty blockers alone may not fully address gender dysphoria. They are often part of a broader approach that includes psychological support and other forms of care. From a health and wellness perspective focused on LGBTQ+ youth, puberty blockers can be a vital tool for supporting the well-being of transgender children. They can help reduce distress and improve quality of life. Parental support is essential in accessing appropriate care and guiding the child through their journey of understanding their gender identity. In summary, parents should consider puberty blockers as a medically supported option when their transgender child experiences significant distress related to puberty. This should be done after thorough consultation with knowledgeable healthcare providers. This approach aligns with best practices in transgender youth health and affirms the child's identity while prioritizing their mental and physical health.